Welcome to the Ambulatory Healthcare Today podcast, hosted by the NextGen Advisors. Accelerate your success with insights from a multidisciplinary team of healthcare experts as they discuss an array of topics. These timely discussions can help you better navigate the challenges of running your ambulatory care practice. Here is your host.
Hi, everybody, and welcome to a new episode of the Ambulatory Healthcare Today podcast, a show where members of the NextGen Healthcare clinical community discuss the latest trends in health tech. Today, we're going to look at a real-life example of how technology is transforming outcomes for a large ophthalmology group. But first, let me introduce my colleague, Katie Chaffee, NextGen Healthcare's Chief Client Officer. Katie, welcome to the show.
Hey, thanks, Dr. Bob. Glad to be here.
Awesome. Katie, why don't you tell our listeners how long you've been with NextGen, what you do, and what do you love most about your job?
Okay. Well, thank you. So yes, I am, as Bob said, the Chief Client Officer here at NextGen. I've been on board about 2.5 years. My responsibilities include really all aspects of client delivery, from onboarding our clients into NextGen to the hosting experience, the support experience, and then the ongoing care and feeding and growth of your system. Our core mission is super simple. We want to create an exceptional client experience while ensuring our clients are maximizing their investment in NextGen. My favorite part about my job is the opportunity to kind of learn from our clients, and specifically hearing from our clients of how they are utilizing and innovating NextGen solutions and how those innovations are impacting the patient, provider experience, financial outcomes, quality outcomes. I feel so privileged to be part of that journey with our clients, and that's absolutely by far my favorite part.
Yeah, I completely agree. I mean, I have for many years, the best part of user group meeting, the best part of a lot of client interactions are just hearing the incredibly creative and innovative and brilliant ways they're using our system to achieve the outcomes that they're looking for, be that clinical, financial, or other, as you said. But in that spirit, today I also have the privilege of introducing our listeners to another Bob, Bob Jasa, who is the Director of Healthcare Information and Technology for Pacific Cataract and Laser Institute, who is a NextGen client. Bob, welcome to the show.
Thank you.
All right. Why don't you, Bob, start by telling us just a little bit about PCLI, the Pacific Cataract and Laser Institute.
Sure. PCLI was founded in 1984, and since that time, we've grown to have 17 clinics in 6 states. Each clinic has an ambulatory surgery center attached. One of the things I think that sets PCLI apart is we have an interior designer on staff. Her job is to make our clinics look like home, and then as employees, each of us is expected to treat patients as if they were our own mother or grandmother.
Thanks for sharing that background, Bob. PCLI is such an innovative organization, so much so that, in fact, they were recognized last year at our 2023 NextGen User Group meeting with an Excellence in Integration Award. For those of you who don't know, UGM is an annual in-person gathering where we host providers, administrators, IT professionals, and others from our client organizations. Every year we hold it in a fun place. Last year it was in Orlando, and this year it's going to be hosted in Nashville, Tennessee. And it is such a special time to bring these passionate leaders from across the country to learn from industry leaders, get one-on-one training with NextGen experts, the ability to test new products and exchange ideas. What have we learned across different specialties, even geographic locations? So much energy that happens during that week. We have a tradition at UGM of recognizing clients for their creative ways of leveraging technology to really solve some of their real business problems. The competition is called our Excellence in Healthcare Awards, and it's fun and inspiring because we get so many great ideas that are coming in from all of our clients.
Yeah, the Excellence in Healthcare Awards and being part of that process and reading through the submissions and seeing, again, just the incredibly creative and brilliant ways that our clients, use our technology and services to make the kinds of experiences that PCLI is looking to make, where going there feels like home. But they actually were recognized, as we mentioned, as being an Excellence in Healthcare Award winner. Their submission, they were describing a project where they utilized the electronic health record, the EHR, Mirth Connect, which is an interoperability tool, and some other third parties. And they launched a video education programs that patients could watch before the appointments, is my understanding. And we were really impressed by this program. Like I said, we won last year. But Bob, why don't you just talk us through a little bit about the project and how you put things together, and then what was the impact both on your practice and on your patients?
Sure. Oftentimes, cataract surgery might be the first surgery patients have had in their lifetime. And then, since it's on your eye, it's also a very nervous thing. So, getting education into their hands before they come into the clinic is very helpful. When you come into the clinic for cataract surgery, you might be offered a choice of getting a specialty lens, which can be a big thing. If you don't even know what cataract surgery is, then the idea of a specialty lens is really foreign to you. So in the EHR, we set up a template so an order can be placed, and then the videos are delivered via the Mirth Connect product. The videos are from a company called Rendia that provides nice animations so that the surgeries are not watching actual eye surgeries, but nice animations of the surgery. And those we review those videos ahead of time to make sure they're what we want to send. Once the order is placed in NextGen, Mirth goes through, picks it up, figures out if the patient wants an email or a text, emails it. That's pretty straightforward. And then if they want to text it, Mirth reaches out via API to a Well or Artera interface to send the patient a text message. It has a short link in there. The patients watch the videos. One of the most outstanding comments I got back from one of our providers was he was going through his regular spiel with the patient about the process and procedure, and the patient said, no, stop. I already saw that on the video. I want to know about X, Y, and Z. And he was super happy. That cut the time in the chair short, and he was dealing with a much more educated patient.
Yeah, I love that. That little tidbit kind of grabbed my attention as one of the judges for the contest. And as a practicing physician, we love educated patients, and so to be able to just through the project that you created, deliver them reliable information so they can kind of master the basics, and then spend that time with the provider, more efficiently and valuably by asking anything above and beyond. So I know that obviously things are up and running, and it's been a successful program, but do you have kind of results that are specific around the project itself?
We do have a monitor that watches the results so we can see how often those are ordered as well. And our physicians are ordering and sending those out. Also, from NextGen, kind of using the same process, our cataract education counselors are sending out those videos, as well as our refractive counselors. So pretty pleased with that outcome.
That is fantastic. I love this initiative because it's about, how do we create a more educated patient and make that experience when they're in the office a higher level discussion for both the patient and the provider. So thank you for that innovation. And I know so many of our attendees at UGM were inspired by hearing that story, and really, how do you use the assets that you have available to create a new experience? I'm going to switch gears a little bit, Bob, and maybe ask you a question. What would you say to a provider, an administrator, healthcare IT professional who belongs in our NextGen client organization and in our family, but hasn't been to UGM before? Should they make it this year, and why?
I've been in the NextGen ecosystem since 2003, and during that time, I've missed less than a handful of UGMs. I can't imagine not going to UGM. The relationships that are there, people I get in touch with again, bumping into other people who are doing innovations. Lunch, you might have lunch with somebody who's doing something that just sparks an idea that you can take back to your own practice and use. So I highly recommend UGM.
I completely agree. And well, thank you, Bob, and thank you, Katie, for a nice conversation. I can't wait to see you both in Nashville at UGM 24.
Thank you, Bob. It's been fun. And thank you, Dr. Bob, for hosting us. We'll see you both in Music City this fall. Just a reminder, the dates are October 27th to the 30th.
Thank you. I look forward to seeing you in Nashville as well.
Terrific. All right, listeners, we know summer is a busy time of year, so appreciate you joining us for another episode of the Ambulatory Healthcare Today podcast. If you are a NextGen client, we definitely hope to see you in Nashville this fall. Make sure you register before July 31st to get that early bird lower rate. And if your organization has a project that you think might be a contender for the Excellence in Healthcare Awards, we'd love to see it. I would love to personally read your entry, as I do all of them. And the deadline for those submissions this year is August 16th. And if you want to learn more about our user group meeting, visit ugm24.com. Thanks again for listening. Until next time.
Thanks for listening to the Ambulatory Healthcare Today podcast, hosted by the NextGen Advisors. Never miss an episode by subscribing at nextgen.com/podcast. To see a list of products and services tailored for ambulatory care practices, visit nextgen.com.